Assalamu alaikum. The communication day. First scenario, Mrs. Amira is 29 years old. She was admitted 3 days ago as a case of pulmonary embolism. The hematology consultant prescribed warfarin for her in the best interest of her condition. She needs she read about warfarin side effects on the internet and she's very worried about this drug. You are the senior house officer of the medical department. You are asked to discuss this issue with Mrs. Amira. Okay, ready?
Yeah.
Yeah, here you go.
Um, Good morning.
Hi, good morning, doctor.
I'm Dr. Henry, one of the doctors here in the department. Could I confirm, are you Miss Amira, 29-year-old?
Yes, doctor, that's me.
Okay, lovely. So, Miss Amira, I've come to, discuss concerning your health with you today. Are you okay? We have the discussion here, or you want any of your family member to be here or friends?
Oh, I think I'm good alone. Thank you, doctor.
All right. So, how have you been doing, Miss Amira?
Oh, it's been a scary situation for me. Yeah, but I think I'm getting much better. Just that I have some questions going on in my mind. I thought I'd someone for with I mean two, I mean.
Okay, Miss Amira. All right. Okay. Before I understand you have many things in your mind to discuss with me. But I don't know if you first of all can tell me, all that has been going on with you and up to this very time.
Yeah, sure, doctor.
All
Yeah,
right.
about 3 days ago, I suddenly have this pain in my chest. It's very, very scary. And
Okay.
thankfully, I called the ambulance service and they were able to bring me to the hospital. So when I came in, I was told I have something pulmonary, which I understand that is something that could be very dangerous. And I've been told I need to go on a sort of medication. The medication I've went ahead to read about on the internet, and the things I found about it are scary. And I'm not quite sure if it's something I want to go ahead with at this time. That's why I just thought to speak with someone. And thanks for coming to speak with me anyways. Thank you, doctor.
Um, Thank you for thanking me. First of all, I want to really appreciate your effort in knowing about your disease condition. I know it must be really very difficult for you at this moment that you have been passing through this difficult situation. But not to worry, we'll support you, to the to the very, you know, end of your journey. Um, if I may ask, you know, can you tell me what you've read about, or what information you've gathered concerning the the prescription we are that is worrying you?
Yeah, basically, I've read that if I go on this medication, in as much as it's going to help me, I can have
Okay.
bleeding, and sometimes I could bleed to death. So I
Mm,
don't know. We're trying to prevent something, and you know,
mm,
tilting to the
mm,
to the other side.
mm,
Yeah, that's so. Yeah, it's alarming to me.
mm. I quite appreciate your knowledge and your zeal in seeking information of such. Actually, if I may ask, sorry, where did you hear this information from? Sorry.
Oh, on the internet, doctor.
Okay. Like that is good. You know that the internet is a huge source of knowledge and information in which you can get something good and also something that is scary, just as what you've listened to. Actually, concerning what you read in terms of bleeding, yes, actually, is one of the side effects that you can find in this particular medication. But just not to scare you, because yes, bleeding tends to occur. It's one of the common side effects. However, there are plans that we usually put into bear to ensure that this bleeding does not occur. Do you mind if I tell you much about this, drug or in full, or you want me to tell you in bits?
Oh, doctor, I want to know everything so that can help me to make a decision.
All right, thank you so much, Miss Amira. Concerning this drug, called Warfarin, that's the blood doctor that prescribed, actually is one of the drug that is used to manage your condition that you've explained so far. It's usually comes in a tablet form, and definitely it can be taken or through your mouth. Sometimes we prescribe it the doses range from 1 milligram to up to 20 milligram, depending on how your body can tolerate. This particular drug it acts by one of the in your liver, and it's broken down by your liver, and then its major function, it tends to allow, it's called the blood thinners, in which it makes the blood in your vessels to flow easily without causing any obstruction. So by so doing, it tends to prevent further clot from forming. However, like you read in the internet, it can also cause bleeding. That is why for any patient that we place on this drug, we usually do a test called international normalized ratio. I've heard of that before.
Yeah, I think I saw something like that on the internet. What is exactly that, doctor?
Okay. Actually, it's a test that we do for people on this drug that tends to monitor to see if they are likely to bleed or not to bleed. So when we place patients on this medication, we usually do, regularly we monitor this substance, we perform this test to check if it is too high for the patient. We decrease the dose, and to ensure that it comes, is within certain, treatment range, which may be from 2 to 3, depending on your particular condition. So that's what to do. So placing you on this medication, we'll be doing this test regularly, and that will also give us a check to prevent from bleeding. Have I been able to answer your question?
Yeah, it does to some extent. But doctor, is there any alternative that I could use instead of this particular medication? Because the bleeding is, I don't know, it's just concerning to me.
Thank you for that. That's a good question. I must appreciate that. Concerning the other medication, yes, there are other medications. They are the ones that they are being called direct oral anticoagulant. They tend to also be taking tablets too, tablet form. Those one does not require, this regular monitoring, and the rate of, they also can cause bleeding too. However, it is quite lesser compared to this warfarin. But one of the drawback is that these ones, they tend to, they tend to be more expensive than the warfarin that was prescribed to you. And then typically, and sometimes, depending on some of them acts, they are being, they require your kidney to be functioning well before you take them, while some doesn't. I don't know if it's clear what I just explained to you now.
Yes, it's clear to me, but just something that is called worrying about being expensive. So you mean one of the reason Amber was not considered for this is just because of the cost?
That is one, and also
2 minutes left.
in some individuals too, they have valve problem. I don't know if you have that. Some individuals have valvular, like a valve problem or valve transplant. Have you ever had that before?
No one I know.
Okay. And also, we also have the other ones called injectable ones, which is called heparin. That one can be given as an injectable ones too. But because, like I said, because you are going to be taking this drug for a very long time, to 3 months to 6 months, depending. And for us to really monitor that is why I think the blood doctor decided to place you on this. Do you have any other concern?
Okay, doctor. So if I agree to go on this warfarin, how long will I take it for?
And thank you very much. That is also a good question. The duration in which for people that have this your own condition, we usually give them 3 to 6 months, depending if it's their first condition or if they have had similar condition. And also depending on their condition, typically some might take for up to 6 months, some up to for life. But I don't, so depending on your own condition, if it is more like we could see some, if it's more like your first time you're having it, most likely should be within 3 months, if I'm not mistaken. But I don't want to bore you. I'm going to also give you some pamphlets that was further explain more about the condition, the drug composition and the duration. How about that?
Oh, good. Thank you. Thank you, doctor.
Do you have any other concern?
No.
Okay, so I'm going to give you a flat. I don't know, just to summarize what we've said so far. We said that this drug, we're going to be monitoring you every, regularly, and then you take this drug to prevent bleeding. And then you take this drug for 3 to 6 months, depending on the outcome. I don't know if that is what we've discussed so far. If we're on the same page, are we?
Yeah, doctor. Yes.
All right. So feel free to contact us if you have any complaint or any fears as you read through this reflect. We are going to send you our helpline number. You can dial them at any time, 24 hours. And if you come into any articles that you are not really comfortable with, we are always there to help you all step of the way. Thank you so much.
Thank you, doctor.
Okay, time is up. But if I add for you 20 seconds, what do you want to ask about?
So if if I may ask, sorry, do you take alcohol?
No, doctor, I don't.
Okay, okay, thank you. All right, because also it can tend to affect this medication too. There are certain other medication. Do you also take other medication too?
Not for now.
Okay, because it can tend to have some other drug interactions too, and also with certain drugs. Thank you very much.
Okay, another 20 seconds to address another thing.
Any other concern?
If more 20 seconds.
Okay. Then I want to ask in terms of your what kind of job do you do, and may I know may I know if you had any if this is your first time you're having this complaint?
That I'm aware of. I don't. Yeah, this is the first time, doctor.
No.
Oh,
I want you to ask about something is very important in this female, 29 years old.
okay. Your pregnancy. Sorry, are you
Okay.
planning of
Yeah.
pregnancy
Okay.
anytime soon?
Oh yes, doctor. That's important. Yes, I'm trying to get pregnant.
Okay. 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 You're about saying something. Sorry to cut you.
Yeah. I just got married, so I'm trying to. Yeah, just trying to get pregnant.
All right. And that's a good question. Actually, it's congratulations for your newly, for your new status that you've attained. Actually, this drug usually is not compatible within the first, in pregnancy, most probably the first and second trimester of pregnancies, basically. And once you've agreed to get pregnant, you can inform us so we can probably change it to other medications like the injectable ones that you can take for the meantime until you will find that you can now proceed if need be. However, since you're going to be taking this medication for just short duration of time, may need to be on the injectable ones. Thank you for informing us about your new status. Yeah.
Thank you,
Okay.
doctor.
Time is up. Consider now time is up. Dr. Ayula, can you comment first?
Yeah, well done, Dr. Henry. Well, you spoke about some of the things that are quite important in this patient. But I think you gave a lot of details that took your time and they allow you to go into some of the things that that you need to talk about. Okay, one thing that I noted down in my notes is the fact that starting from the pulmonary embolism, the diagnosis, she had told you that she had pulmonary embolism and she's been placed on medication. I think the first thing to ask her is, has anyone told her what this pulmonary embolism is exactly? Which that should have been the first thing to ask. And just tell her there is a clot in the blood, and that will give you entrance in the vessel in the lungs, and that will give you entrance into warfarin. And the warfarin was prescribed in the best interest in your best interest by the hematologist, which is the blood doctor, which is a specialist that manages situation things like this. Okay. Yeah, and I like the way you entered into the where she read it from. You acknowledge her knowledge, and you were, I mean, you acknowledge our knowledge, our effort in getting to know more about this, which is good. And you confirm that yes, truly, warfarin causes bleeding, which and another good thing that I believe. The one thing that you did not say, which I think is important, is that as much as warfarin causes bleeding, the risks, the benefit of you being on warfarin at this time outweighs the risk of the bleeding. But not to worry, we'll keep monitoring you, which you eventually talk about the monitoring and I mean, and every other thing that you said about the monitoring the INR and things like that. I think at this point, okay, you didn't mention the value. It was when you get to the DOAC, talk about some other things, which I think is good as well. Then another thing that even when I asked you for any alternative, you gave information to me about alternative to, to warfarin, the DOAC, the heparin, which is good. But I think the way you presented it, you gave a lot of information about this. Something like, yes, at this point, with the blood doctor, I've evaluated you and place you on warfarin in your best interest. But however, there are some options. Just mention them: direct oral anticoagulant, even the one that can be given you through underneath your skin, which we call the heparin. But this time, this has not been recommended. But if you want to have a further conversation about this, we can assess you and look at if you fit into any of the criteria to consider it as an alternative in your case, because we have indications why, we have reasons. There are reasons why this is given. I think this might answer the question and avoid you talking about costs, because costs is not a reason not to give the treatment, which you did mention. Okay, then how long will I be on this heparin when I asked about it? You mentioned some time, days, 2 to 3 months, 3 to 6 months, lifelong and everything. This was not given in the question. So I think in this, I think to just being diplomatic about this, that there are several. We have options about how long a patient can be on this treatment. This could be for 3 months. It could be for lifelong, depending on the individual circumstances. Okay, but depending on individual circumstances. In your own case, I think in your own case, I'm not, I think I'm stuck there, but I'm just not quite sure that you need to mention some persons 3 months. I think just like in your own case, we need to we need the needs to be further discussed, and then if it's going to be 3 months, if it's going to be lifelong. But I believe maybe in the exam they will give us exactly the duration that this patient will be on it. But it's the way you answer was also good, because you mentioned the duration that the patient needs to be on it. Maybe Dr. Bazim and any person can help us with that aspect and look at if there's a way that this can be constructed. There's some advices that are actually important in patient taking warfarin, which I think that even just one sentences we need to mention. Like, you are going on warfarin, but if you want to go on any new medication, if the patient has agreed anyway, at this point, do you think you want to consider warfarin option? Yes, I want to consider. As you've agreed to go on warfarin, if you're starting a new medication, you need to let the clinician knows about it, because a lot of drug interacts with warfarin and may increase or reduce the rate at if warfarin works. Another thing we advise is your diet. Okay, there's some diet that interact with warfarin, but not to worry. I will refer you to the dietitian that will talk about it more and give you some food lists that can interact with warfarin and I'd probably avoid. Then the pregnancy that you mentioned, which is also good, is 29-year-old lady. Okay, just ask Are you trying to get pregnant anytime soon? Oh, good. If you get pregnant, please do let us know, because warfarin is something that is not compatible in pregnancy because it can affect the baby. So do let us know, and then we can change to other form of which you answered well. Yeah. Then I don't know if in case of medical bracelet can come in a patient taking warfarin. I think it's so important. The patient warfarin can bleed, and just for us to know that this patient is on a form of anticoagulant. So those are the things that I think. Then social history, also important, like you took in this patient. So those are the things that I think. Check understanding, and tell patient that will refer to you continue to be follow up in the anticoagulant clinic, which is run by a specialist, and I give you leaflets like you did. Well done, Dr. Henry. You did well. Thank you, everybody.
Okay, thank you, Dr. Ayula, for your comment. I will try to summarize the case quickly as much as I can. So, the agenda of the scenario to confirm the patient data and the introduction. Sorry, give me. Okay, sorry for the interruption. Now I will talk about, in summary, what the points you have to talk here. After the introduction, of course, you did it well. And the invitation, you can invite someone here. It's okay, invitation. And the points to be discussed in this scenario will be the frequency, the dosage, and the route of administration, which is oral. Then, and don't go in deep. This is very lengthy scenario. If you will talk about all the mechanism of action, how it happened, and how it does, you will waste the time. So what you will do, just briefly, this medication is a very common and popular medication that usually used whenever there is blood clot. And in your condition, in the best interest, it was prescribed for you in the best interest. How it happened or how it does work by thinning the blood. That's it. If you will go through the vitamin K and the liver, you will waste a lot of time. So it's a very common medication that thin the blood. Next, you will take it once daily according to the dose. We will be adjusted and followed by the clinic, which is called INR clinic. No need to explain what is the INR. It's one of the clinic concerned to having a target thinning of your blood. Then that's it. So the INR finished. No, don't try to talk about things which is, yes, important, but it will waste the time. You have a lot of things to discuss in this scenario. By the way, be sure any counseling medication, mostly they will bring a female in the childbearing age. Why? They will test if you will discuss the pregnancy and the OCP as well. So please put it in your agenda whenever you are going to the station to talk about or to put the pregnancy as one of your point you have to discuss. Okay. Let's continue our mechanism of action in our clinic. If she had or and interrupted you with a concern of please, do you have or any other choices for the blood thinner? Yes, there is a lot of choices and different alternatives. However, in your condition, in the best interest of your condition, this warfarin is the best. Don't try to explain again any other option. Why you are going to explain the DUAC if you will not prescribe the DUAC? Once also you start to talk about DUAC, you give here the indication of DUAC. And this is not in the scenario. You waste more time. It's one of the indication valvular heart disease. This is not the scenario at all. The patient already having pulmonary embolism. Why you are talking about DUAC and the contraindication of DUAC, the valvular heart disease? So this is not the time at all to talk about any other option or alternative. The best interest, this medication prescribed for you by the blood doctor. Next, then yeah, for how long? Okay, the duration. it's not clear for me so far about your condition. However, mostly it lasts months, right? It's not less than 3 months. Usually, the provoked for 3 months, unprovoked 6 months, or recurrent, as you said, lifelong. But you don't know what the situation. So you can say we will reassess you from now and then to decide for how long you will take this medicine. Don't go through the indication for how long and some case. If you spend time to explain everything, you'll not have time for the other concern, which is very important. And I told you in this scenario, you miss the three important things: the alcohol, the pregnancy, the birth, OCPs, as well as the smoking. Smoking also one of the enzyme inhibitors or affecting. If you will not say inhibitor, you can say it's one of the affecting. The smoking is affecting the liver, or it can affect the metabolism of this medicine, right? Okay, what else you miss? Okay, we finish now. The duration. It's a lengthy one. It can be lasting for months. However, we will assess you again till what date you can take this medicine. Next, now the time to ask her. Even if she want to talk, you have to do this, the very important things here, which is the pregnancy. Can I ask you some question? Yes. Are you pregnant or any chance to be pregnant, or are you planning for any pregnancy? Yes, doctor. Actually, I am. So congratulations, and I hope you can arrange with your woman doctor, okay, to postpone your pregnancy. Why, doctor? Because it's unsafe to take this medicine with the first months of pregnancy. So she has to postpone her pregnancy, right? And she had to take some of the mechanical or whatever the contraception. Okay, or at least let her arrange with the baby doctor or the woman doctor when to have safe and good pregnancy, along with the decision of starting the anticoagulant or continuing anticoagulant. Because as you know, sometimes you can switch to low molecular weight heparin, enoxaparin. But why I will put this risk to the baby? He will be there. It might be shortly, so I can't talk about 3 months. Then she can have a pregnancy. No need to decide now for pregnancy. Okay. The next, the alcohol, as you said, it can affect smoking. As I said, it can affect the job. You miss the job. What's your job? Maybe she's doing training or sports, right? Some contact sports. So she might be at risk of any trauma during her job. So you have to address this issue. Please take care of your job, or if you not to have any trauma at your job. It will be risky to have a bleed. What else? Important, related also, not as a job, as risk to have a trauma. What do you think? Let's open the discussion, and I read this question. Who knows? What is the thing you can talk about and to ask the patient about? Okay. And it can be risky to do it while taking warfarin. Anyone knows? Anyone knows? We mentioned the job. What else you can discuss? Okay. If she's contact sports, it's enough. If she's training, for example, it's enough. What else similar to it? Not as a contact, or if she's not doing this job. Okay, dealing with machines, hard object or sharp object, you mean? Good idea. What else? What about the hobbies? Hobbies. Someone is interesting to do hiking, going up and down mountains. So you can also hold or stop this, right? So you can find a lot of things you have to talk about. Please don't spend a lot of time to explain the mechanism of action or to talk about alternatives, which is not your scenario or not your task. Your task here to convince the patient with warfarin. Okay, at the end, what you will do? Are you agree to take this medicine after you read in the internet and after our discussion? Yes, you have to appreciate her reading in the internet. But as Dr. Henry said, sometimes the internet shows the bad side effect of the medication more than the benefit. That's why I'm here to explain to you the more and the best interest of your condition. What about this medicine? Does it help in your in your condition? Okay, this is the way how to convince. But you have to appreciate whatever she's doing. You have to appreciate. I read, yes, I appreciate your reading, your knowledge. Thank you for sharing this with me. Thank you for your concern. Okay, always appreciate what the patient is doing and saying. Otherwise, good, Dr. Henry, don't forget the social. Okay.
Thank you very much.
Okay, thank you, Dr. Henry. So I wrote the comment, the concerns here. Anyone interested? It can cause bleeding to death. How to address this? Anyone want to address it? Apart from Dr. Henry and Dr. Ayula? Anyone want to discuss this concern with me? Okay, Dr. Henry, as no one, you can answer this again.
Okay. Which
Do
of the
you think,
concerns?
yeah, it can cause bleeding to death, doctor? I read in the internet, this medication can cause bleeding to death. Or please, Dr. Henry, wait, because you answered it already during the discussion. I want someone else, anyone interested, please be brave to talk. Dr. Muhammad, you are unmuted.
Yes, I can do it.
Okay, please start
Yeah.
with the first concern. Doctor, I read in the internet that this medicine can cause bleeding till death or to death. How to address this? Yes.
Yeah, I really appreciate your concern, but I would like to assure you that we are going to give you this medicine in a controlled dose that can control your condition, and that would not cause a bleeding uh, to degree that can lead to death. And we are
Exactly.
going to monitor you and to monitor how thin is your blood while you are taking this medication. So again, I would like to reassure you that this wouldn't happen. Yeah.
Okay. Always, as I said, if she does something, appreciate it. Yeah, appreciate your reading, your knowledge, and sharing this with me.
Yeah.
But you have to answer it. Sometimes, yes, it can cause. Okay, don't give her false hope. Yes, there is. If you have, for example, severe trauma and it might lead to severe hemorrhage, but don't say all this. What I mean, you have to answer as yes or no. So you have to say, I'm afraid. Sadly, yes, in some condition, which is very minimal, it might happen and it might lead to severe hemorrhage or bleeding, which can lead to death. However, now the time to reassure. Okay, so you start to by the truth, then the reassurance. However, with a frequent follow-up in the clinic, blood clinic, and the thinning of the blood level, you will be monitored every now and then, and we will put the target for the blood thinning level in the limit we have requested or recommended, okay, in this way. But please don't skip or overlook the concern. The concern is clear, so you have to answer it clearly also because it's a truth, okay? Next question. What is the INR? Suppose you will not go and to say INR, but if she ask you, what you will say? What is the INR, doctor?
The INR is a test through which will look how thin is your blood, and depend on this test, we are going to give you the dose according to this test and according to how thin is your blood.
Yeah. Perfect. So we will adjust the dose according to this level.
Yeah.
And it's a clinic. You will be followed up in this clinic regularly. Okay. Is there other blood thinner, doctor?
Yes, I appreciate your question. It's a valid question. Yes, there are other options, but the blood doctors has prescribed this warfarin in the best interest of your condition.
Perfect.
How
That's
does it
it.
sound? Yeah.
Yes. Oh, okay. Am I clear that how that sound for you?
Mm,
Yeah. So, but don't speak a lot because you have a lot of things and tasks to do. Okay.
yeah.
Yeah. For how long, doctor, I will take this blood thinner?
Uh, yeah, this is valid questions. It depends on your situation. Usually, we prescribe this plus thinning for 3 to 6 months, but it depends on your condition, and we are the blood doctors will evaluate you, and then they will decide for how long to take this
Yes.
medication.
Exactly. So it depends on your condition. However, it might be for several months. Don't say 3 to 6 because yes, it's evidence-wise, yes, as I said,
Mm.
but you don't know what the condition. So you can say
Yeah.
several months, and
Okay.
some patients they might take it lifelong. However, it depends on your condition, and we will reassess you from time to time with the
So
blood
that.
doctor.
Yeah.
Yeah, to tell you exactly till what date you will take this medicine. Okay. Okay. Thank you, Dr. Muhammad.
Okay,
Good.
Dr. Bassem.
Yes, good performance. Thank you. Doctor, there's a question. Should speak about don't take any other medication without inform your doctor that you are on the warfarin as it may interact and may change the effect of warfarin. Perfect. It's one of the most important point in warfarin particularly, not only the drug-drug interaction, even the food itself can have some interaction. As you know, the plants and some vegetables can inhibit or activate. So in the best way, you might be followed by our dietitian or diet specialist. Why? To prescribe for you what is the best to avoid in order not to have the toxic effect of the medication or interaction with the medication. Because there is a lot of foods or vegetables that can interact with the medication itself. Along with other medication, please don't take other medication unless you are visited or visiting your GP and asking him about the new medication. There is a card, yes, there is a card for the warfarin, so you can add also, you can carry this card with you. Clear for all? I think we covered the all points of the warfarin. Anyone has other suggestion? He can talk about it or suggest it. Dr. Ayula, I will read your scenario quickly, and if anyone will comment, please feel free and you are welcome. Mr. Musa Adamu, 55 years old, gentleman, diagnosed with multiple sclerosis for 5 years, prescribed with a significant difficulty swallowing, presented with a significant difficulty in swallowing. Given his condition and the challenge he faces, there have been multiple attempts to insert NGT nasogastric tube. Unfortunately, Mr. Musa has been consistently pulling it out, likely due to his disorientation or disoriented state, raising concern for his well-being and nutrition. Taking this into consideration, the consultant has recommended the insertion of big tube, percutaneous endoscopic gastrostomy tube, to address his feeding needs. Your task is to talk to Mrs. Fatima Amadou, the wife. Explain about the big tube for of insertion. Whenever you
Yes.
anyone want to add any comment or suggestion for the previous scenario? If no one, we can start the second scenario, please.
Okay. Hello.
Hi, doctor.
My name is Dr. Ayola. I'm one of the I'm one of the doctors, sorry, that is looking after um your father. Can I confirm your name, please?
My name is Fatima. Fatima
Mhm.
Adamu.
All right, nice to meet you, Fatima. Could you confirm your father's name and age, please?
Actually, my father, my father is not here. Sorry.
Okay, all right. I was just saying that could you confirm your father's name and age? Is that okay?
My father, my father is late, doctor.
Oh, sorry, Mrs. Sorry, okay, that must be a clue for my part. Okay, so can you confirm your sorry, you understand you are Mr. Your husband name and age, please?
All right. Thank you,
All
doctor.
right.
My husband is Mr. Musa Adamu. He's 5 years.
All right. Oh, I'm so sorry about the earlier confusion. Okay, have apologies on my part. So to discuss about your husband. Can I ask if you are the next of kin to your husband?
Actually, I'm not, doctor. But I'm he's only surviving. I've been married for him for a very long time now. And I've been living with him. But most likely, I'm here to make decision for him.
All right. Okay, good to know that you're here for him. Okay. So do you want anybody to be here while we discuss about about him?
No, I'm okay. I'm okay,
Yeah,
doctor. I'm
okay.
okay.
All right, okay, good. So we are here to discuss about your husband and the update about his health. All right. Before I speak about what about this, are you all right to tell me what you check your understanding about Mr. Adamu's health? What do you know about him?
Oh, doctor, my husband is a lovely man. 5 years ago, he was diagnosed of a condition called multiple sclerosis, and
Mm.
has been, there. He comes and go, but for the past few months now, he has been really, really bad. Each time he comes down with some chest problem, but recently, he has not been fine. So
Mm.
they passed in a tube through the nose several times, but he has been because he's confused. He has been pulling it out, you know. So and we are asked to come and see you for further advice, doctor.
You're all right. Yeah, I can see it has been a difficult situation for you. I mean, for the whole family concerning what you've said about Mr. Adamu. But is it all right? Do you all right if I do you mind if do you understand what multiple sclerosis is exactly? Which I think might be a good place to start.
Well, doctor, they told us about this, from the very outset. But I think it's a long time ago. I can't really recall what it is now again, but I think it has to do with weakness.
Okay, yeah, yeah. It's basically okay. So it's basically one of the a condition in which this affects, you know, it's a condition in which the body the immunity of the body is disturbed and it begins to fight against itself. And one of the way it manifests, is it it's I mean it's the individual tends to start having some weakness and which can also cause some difficulty with swallowing, which is something that we've observed about Mr. Musa. And that was why we make attempt to give him the tube that we gave him through his nose. And it was really difficult to put it down because his, his nutrition and well-being has become a thing of concern. And this needs to be attended to, okay? As we have difficulty in doing this, the consultant has reviewed him and advised that we go ahead to the next way of feeding, which is what we would normally do in situation like this in the best interest of the patient, which is to, give him what we call percutaneous and endoscopic tomy. I know it's a big word. It's just basically a tube. Have you heard about that before?
No, doctor. No, doctor. Doctor, what did you call it again? Sorry.
Okay, it's a PACUT. We call it percutaneous endoscopic gastrostomy tube, and
Okay.
it's a big one, like I said. But what it simply means is just a tube. It's a tube, I mean, that we put directly into his stomach. to feed him. Is it something you've heard about before?
No, doctor.
Doctor, okay. And is it all right if we talk about it exactly now?
Yes, doctor.
Okay, so basically what we are trying to achieve with this tube is to help him with his nutrition, find alternative of feeding him because he has difficulty with swallowing. And this is usually a surgical procedure, okay? That the tube is inserted through the mouth and it comes out through the tummy, and it's done on with a camera with a camera by specialists who are quite good in doing this. Okay. And of course, there are reasons why we do it, which in your husband's situation is because he's unable to swallow well. And okay, normally we will assess him and see this. It will be assessed to see if there are any reasons why he should not get this, which is what we would normally do. Do you follow, Mrs. Musa?
Yes, doctor, I do.
You do follow? Okay, all right, good. So, of course, this procedure usually lasts about 30 to 45 minutes. And after the procedure, there's the tube. There will be a little tube in front of his tummy that we can use to feed him with. And of course, there are some side complications that can come out from this procedure, which I believe is a good thing that we discuss it today. Do you follow me, Mrs. Musa?
Yes, I do. I follow you, doctor.
All right, okay, good. So it's just, this complication for surgery can include infection, pain, but not to worry. The procedure will be done under some pain relief. We'll try to give him some pain relief around that area. Infection will be managed well, and the tube at some point can also block, but these are things that will be well looked at after by the specialist nurses who look well after this tube. Okay, we also involve the nutritionist in his care, who will also give you some advice and teach you on how to use this tube for him, because the family will also be involved in his care. Do you have any question at this point, Mrs. Musa?
Yes, doctor. Doctor, this tube we are talking about, is he going to take it for life? Use it for life, doctor?
Oh, that's a good question that you've asked, Mrs. Musa, and I can see that it's really something that is really concerning to you. Well, as it is now, because the condition is a progressive thing, possibility that Mr. Musa will use this for life. So there's chances that this will be for life.
Okay,
Not to worry,
doctor,
we'll support you all through the way and see how we can help you to do this. Okay.
Okay, doctor, you keep on calling me Mrs. Musa. All the same, okay. Actually, is there any other alternative, another way we can use outside this PEG tube that you mentioned?
2 minutes left.
Yes, that's a brilliant question, Mrs. Adamu. Sorry about the name again. Yeah, there are other options that we can do for him. The first one is the tube that we spoke about. That's the NG tube that I spoke about earlier, that we passed through his nose. This, which is difficult in this case. Another option will include to put the tube through the small gut. All right, but at this point, it has been put down to the one through his stomach. Not in his best interest. Is that okay? I said, does that answer your question?
Well, yeah, it does in a way, but what will happen if I refuse?
Well, like I said, if you do if you still, may I ask why you think you might not want to have this tube?
No, I just feel like, I just feel that, you mentioned a lot of things when you're trying to infection, bleeding. I'm scared. What happens if I refuse?
Yeah, that's I can see that you're really worried about this tube, okay? But don't worry, Mrs. We would support you as you go through this journey with the tube, with the specialists that we have. Or however, if you don't want to go ahead with this thing, I think the first thing we want to do is, to speak with my consultant so that I can also have a chat with you about this, and possibly might be able to speak and give you small advice about things that worries you about this. Okay? And then, yeah. Gio, are you with me?
All right.
Okay. All right. So, by the way, how is how have you been supporting Mrs. May, your husband? Is there anything concerning that you think you might be needing us to support you with?
Yes, like it is now. I don't know. I've been battling, getting to the ideal food for him and how to feed him. Yet he keep on moving the tube. So I'm worried if you get, if you might eventually die of starvation, kind of.
Yeah, I see that. I appreciate your concern, and that is why we want to give him this tube to help him with the food, which I believe once he had the tube and we're able to feed him well, he would improve. The dietitian and the nutritionist and the specialist nurses would also be involved to teach you and everyone that will be involved in his care, because at the point you may need to do it at home as well for him. Okay, put you to teach you on how to, and the best diet that will be appropriate for him, which I believe, which I think will be able to help him with his nutritional needs.
Okay.
All right.
Okay, do you understand what we've said so far? Do you have
Yeah. Thank you, doctor. I do.
Allow me to speak with you today?
Okay. I added 1 minute and 20 or 30 seconds now, just to address the overall concern. Thank you, Dr. Ayula. Well done. Dr. Henry will comment, then I will comment.
All right. It was a good one. Just like you did very well. Your flow was good and everything. Just to add some few corrections. Initially, you missed the the patient relative, the relative or the relationship the patient has to the what do you call it? Yeah, you miss yeah, to the patient, to the patient that you are discussing with, the patient relative. You kept asking of the father. The patient has to joy that the patient did not want to allow you to continue making the mistake up to the end. If not, if you continue making the mistake up to the end, that might not be good, so good. Then the next thing that you should have done to make your communication superb was to draw a diagram for her. If possible, you should have drawn a diagram. I don't know, just a small caricature diagram of the food pipe as it connects to the stomach, then something like a telescope, like an endoscopic with a light at the terminal end. Then another, kind of how the pass through the skin, the tube, saying that it's a flexible tube. When I mention tube, it can be a metal, but you should probably say that it's a flexible tube because to him, since you didn't say, he just mentioned tube. Tube can be anything. It can be a pipe. It can be, it can be you know what I'm saying. It can be a rubber.
Yeah.
It can be a plastic. So just okay, you can just okay after you draw it for him, diagram say it's a flexible tube. You can like easily, it's a flexible tube like the word implies. Then describe how it went, how probably the procedure will be done in an endoscopy room. It's not a procedure room, not really a major. It's not a major, procedure like it's not a major surgery like you said. Within 45 minutes, we are done. It should be done by a specialized doctor who will take you to the procedure room. Not to worry. You talk about the procedure, but you talk what happened before the procedure. Definitely at this point, we will not, you can just say, okay, before the procedure, you will not need to feed him with this tube, this NG tube that is currently on before we start this procedure, for
Okay.
a while. Then you will just have to, like, you will give you something numb, like something like if he's restless and is appearing more agitated, you need to give him something that will just make him calm a little bit. Then, like it can cause some irritation. After I talk about the procedure itself, then the post procedure, like what you mentioned about some of the side effects in terms of the bleeding, the pain, and you also talk about how you're going to manage those what do you call it, side complication basically. Then other complication like you've mentioned too also can cause some blockage. It can, around the skin. Sometimes it might yield with some some tissue around, but not to worry. We'll see how we can do to ensure that these things do not occur in his own case. Then also towards the tail end, when I asked about the how long will this patient be on it, you said, is it going to be for life? You said yes. You are not supposed to ask, because currently, PEG tube usually it depends on if you get better, probably it definitely, because it's not dying anytime soon, kind of. Although currently it's using less. If probably what is having is kind of is a relapse, maybe a
Yeah.
relapse in the meeting. You can't say you don't know the kind of MS he has.
yes.
So you saying that it's going to be for lifelong, to me is not really so sweet. Probably you say at this point that you cannot really say, but however, we'll continue to monitor him until he can able to resume back his oral feed, and then depending on his outcome, definitely. Then the next question I ask you is that, is there any other way in which you talk about the previous NG2, and they also mentioned about the also jejustomy tube or ilio gastric tube. They're all the same site too. However, this is for his best interest. This is what which is good. And according to Dr. Bazin, if you just summarize it's good. That was okay. Then last one, what happens? What will happen if I refuse? So very technical questions, but the way you answered it which is well, it depends on how, but I would have answered it in the case that, okay, I understand your worries. You asked the reason why, which was good. Then I told you that because all this is you have been saying, you decided first to mention. Yeah, you say, okay, I appreciate that. Appreciate the patient, feeling and everything. But let him understand that as it is now, he's not receiving the feed through the NG tube, and this is other one. If you refuse this one, his condition is going to get worse, because there's no way he can be getting his feed or his medication. So him refusing this one, we at the long run may not be beneficial for him, because there will be no good. He will not be having his feed and his medication at when due, and that may end up, allowing his this condition to get worse by day. If you will be happy if his husband condition become deteriorated? You will not say no, of course. Okay, definitely. So that is where I would have approached this situation. But by and large, it was a good one. Thank you very much, Chief Arela. Thank you.
Thank you. Sorry.
Okay, thank you, Dr. Henry. Well done, Dr. Ayula again. I will ask Dr. Ayula a question. Why you explain the MS in this scenario?
Okay. Why did I just thought like
Do you think it's wise to spend some time explaining the disease? What do you think?
well, I think I just wanted to check the understanding of this patient, and then find a way of letting her know that the weakness affected the swallow.
But yeah, if you would ask her, do you want me to explain it? Definitely she will say, no, doctor, thank you. I know more about it. Why? Because she will save the time for you to explain about the procedure, which you miss some of the parts of the procedure. Okay? I will start now.
I just want to ask the question, do you think that it's not appropriate to have that? Should I explain it to you?
Yeah, it's not in this scenario. This is a scenario of procedure, right?
Yeah.
So you're gonna explain a lot about the procedure before, during, and after. Let's comment about the introduction itself here. You mentioned, yeah, because mistakenly you said the patient relation, which is wrong. Take care of this, please. You spend 1 minute to confirm what the relation between the patient, where is the patient, what the surrogate or what the person you are talking related to the scenario or to the patient. And for 1 minute, you're asking about the father, which is at home or dead. At the end, you know that this is at the end you realize this is the husband. So take care. The relation, the every sentence in the scenario is very important. Okay. Now, the invitation. I don't think you can invite someone, because this is, even she told you, I'm not the next of kin. I cannot even here invite someone, right? Because she said, I am not the next of kin. But you are here to discuss with her. So you will discuss, but anyway, I will discuss with you about the condition. But I will not ask to invite someone, because already she is not the next of kin.
Mm.
But she is the one looking after him. So I will discuss with you, because this is my task today, to discuss with you. Let's continue. Before, during, and after. Before, you didn't talk totally about it. Your husband will be prepared, doing some blood test to confirm that nothing will harm him, the blood thinning, the condition of his gut, okay, is ready to do this or no. This is regarding before. And he will be admitted to a unit, which is called endoscopy unit. Okay, before that, of course, you have to explain the name of the procedure. Big tube, as you said, it's a percutaneous endoscopic gastrostomy tube. Don't go to the name; it's very long one, so we can do it, or we can say big tube, just to make it short. Okay, then explain. It's a tube which is you can draw. Of course, here I agree to draw the mouth opening, the food pipe, the skin at the tummy. We will open here. We will do some small cut. Okay. But before that, you have your husband should be prepared by doing some blood tests. Okay, that's it. Next, the during your husband will be sleeping, we will be sure that he doesn't have any pain, because this is the most concerning always point in the procedure. The pain doctor, does he feel pain? So you have to reassure from the start that he will not be feeling any pain. Okay, along with our pain doctor. The camera scan doctor will be there. The gut doctor will be there to confirm and be sure this procedure many times has been done by our team. They are expert and so on. There is some complication. Yes, every procedure has risk and benefit. The risk in this procedure, as you know, and as I prefer always, 2I and 2Ps. This is the minimum to say, okay? 2Is in the form of injury and infection. 2Ps are pain and bleeding. Okay, at least those you have to mention. You have a lot of the blockage, dislodgement, yes, but at least mention those very common and very serious. The others will be as post-operative or at home for the care. Okay, let's go back to the so you will pass the camera scan through the food pipe, then we will open the cut here on the light, and we will pass the tube. It's a plastic one or whatever the type, so it will be here inserted, and going back with the camera scan, then this tube will be fixed to the skin. So it will be difficulty to be dislodged or to be removed. Clear? This is regarding during. So you are sure about the pain, you are sure about the procedure steps. After, what will happen after? Your husband might stay at hospital for certain hours, and he will be followed and monitored by doing some blood tests, some scan to confirm the place or the position of this tube and the function. Okay, is it functioning well? Later on, we will let you sit with the nurse, specialized nurse, to educate know how to educate you and to teach you how to deal with this tube in the coming days. Okay, these are the points during, before, and after, and the consent form. Be sure there is a consent form should be signed. Don't talk about who will sign. You will be in trouble if you ask. You will sign. Of course, this is not the person to sign it. The husband, you are not sure about his conscious level and capacity, so don't raise it. There is a consent form to be signed before the surgery, that's it, or before this procedure. Don't talk about, but you have to raise the issue of consent. Okay,
Mm.
finished. Now the support, with whom he's living, does he need any kind of support? Anyone at home need a support? Let us know. you cannot say speak more about other social. So you cannot say the smoking, the alcohol, or whatever. Clear now, Dr. Ayula?
Yeah.
Yeah. Please don't spend time to explain something which is unnecessary or not related. Yes, it's related, but this is not the time to explain. Okay, the same as the first scenario. Dr. Henry explained about the condition or the medication more. Yeah, he should say, but he shouldn't explain more because you have a lot of other tasks or a lot of points you have to raise. Is it clear? Okay, Dr. Ayola, you want to ask anything or to comment?
No.
Okay. Anyone, Dr. Lina, you want to ask any question?
No, I think you've said it all, Dr.
Okay.
Baz. Thank you so much.
Okay, thank you, Dr. Ayola. Now I wrote the comments. Sorry, the concern. Dr. Muhammad, you are ready to discuss these concern by yourself? To Muhammad Omar, if you are available, we can discuss it quickly and briefly. Just a kind of training. To Muhammad Omar. Anyone else?
Dr. Basim.
Okay, good. Good, you are here. Let's discuss it quickly. I will not take time. What is the big tube, doctor?
I really appreciate your questions. It is a kind of tube. We use it just to feed your husband.
Mm-hmm.
So this tube will be inserted directly in his stomach, in his tummy, through the skin. So the gut doctor will go through the camera, and he will insert this tube through the camera from inside his stomach, and the tube will be outside, attached to his skin, just to feed him. How does it sound?
Okay, you didn't add. Yes, yes, I
Mm,
would. I'm with you. Okay, you have to add something which is mentioned in the scenario. What do you think? They wrote in the scenario that the NGT tube tried or trial
okay,
was
okay, okay.
yeah.
Yeah,
So
yeah, yeah,
that's
yeah.
why in the best interest
Yeah, yeah, yeah,
they
yeah.
have decided to do right,
Yeah,
and you have to
okay.
say the name of the tube. You didn't say
Yeah,
the procedure. Okay, good.
okay, okay. So I have to
Next,
mention the name of
yes,
the procedure,
at
and then
at least once.
okay.
Big tube, we call it. It's a very long name. It's called percutaneous endogastric tube, gastrostomy tube, and we abbreviate it as big tube in order not to waste time to explain it every time. Okay.
Okay.
The second, is it for life, doctor?
Yeah, this is a very good question. Most probably, we'll put it for now, and we'll reassess your husband. To be honest, Dr. Batum, I have no answer for this concern.
Yeah. What do you think about the condition itself?
Uh, I
Yeah,
didn't go through
it's
the scenario. Yeah.
it depends
Okay.
on this.
On
Yeah,
the
the scenario is multiple sclerosis. What do you
sclerosis.
think? Yeah, the weakness will improve. Do you think it's something to be?
No.
Yeah,
Yeah,
yeah.
it
To
will
be
be. I
honest,
think. Yeah,
yeah,
to be honest, the tube will be for life. Um, considering that your husband has this
exactly.
uh, multiple sclerosis, and his swallowing is not good and not great.
Perfect.
Yeah. So yeah, it will be for life.
Yeah. Okay, so I think here no chance to be
Mm.
removed unless there is complication happen. But based on your husband condition, which is having weakness in the swallowing muscle, it might be for long time. Even you can say it's lifelong. Okay. The next, any alternatives, doctor? What do you think?
Actually, we've tried the nasal feeding through the NG tube, as you know, but your husband couldn't tolerate it, and he removed it many times. So the consultant chose this procedure in the best interest of your husband, because taking into account his condition and his conscious level. So this procedure chosen on his best of interest according to his condition. How does it sound?
Yes, doctor. Thank you. But there is also one more option to be to know it. Okay, add it to your knowledge.
Mm.
There is what's called rectube,
Rec tube.
radiological inserted gastrostomy tube, radiologically one. Okay, and it
Okay.
came before in another diet, so don't forget
Okay.
it.
Rec
So
tube.
either camera scan by the gut doctor or
Okay.
gastroenterology, or it can be by the radiology intervention. Okay,
Okay.
it's called the RIG tube, RIG. So this is big B PEG, and there is
Rec tube.
RIG,
IG.
RIG tube. Okay, and it will be inserted in the scan department by the scan doctor or the imaging doctor. Also by the guidance, they can see it. But in the best interest, this is the best now for your husband. But I add it to your knowledge and others. Sometimes they might have it, and you will be shocked. What is the RIG tube?
Okay.
Okay, the next, what you will do if I refuse, doctor?
Yeah, I appreciate your question, but may I know why you will refuse it, Mrs.
Perfect.
Adam?
Very perfect answer. You should know why I refuse. Why you refuse? Because it might
Yeah.
be something in her mind and you will go through another track.
Yeah.
You know why, please, you should do, I should, and you will explain and wasting a lot of time. Then she will tell you, doctor, I'm afraid of the complication. Oh my God. So why you didn't ask her from the start? Why you're afraid or why you don't do it? Why you don't want to do it? Why you are refusing it? Then show the time by saying and address the concern. Why you are refusing? Can I know? Yes, doctor, I am afraid of the complication. Then you have to reassure about this.
Yeah, your worry is valid, Mrs. Adam. But I would like to assure you that we are going to keep eye on him and will monitor him for any complications. And the team who will do the procedure, they are very expert and they know how to deal with this complication. So from this point, he will be monitored and he will be followed up for the complications. How does it sound?
Yeah, perfect, doctor. Thank you for reassuring me. So you have to reassure by the many time, the group of doctors, the pain doctor, everyone will be there.
Yeah.
The last, how to use it, doctor?
Yes, your question is valid, Mrs. Adam. So I'm going to link you to one of the specialized nurse and to the dietitian. They will teach you and they will train you to how to use this tube. So from this point, we'll take care of this point, and before to go home, you will be aware about how to use this tube. Is that okay with you?
Yeah, perfect. So you have to arrange appointment and
Yeah,
another time to be
meeting.
explained. Yes, meeting. Yes, perfect.
Yeah.
Thank you, Dr. Muhammad. Well done. And all concerns. Thank you.
Thank you, Dr.
Yeah,
Bassem.
most welcome, Dr. Muhammad. Anyone has any concern or question before ending the session? Yes, someone wrote here. Yes, better to, yeah, of course, any procedure, it's the time to draw. Any draw you can do. Simple draw. Don't do it as a complicated one. Okay?
So,
Just that,
Dr.
yeah.
Bassem, I have one question. In this
Yes.
scenario like this, if the wife is not next of kin and if the patient is not competent, just regarding the consent, just I will mention it, but I will highlight the consent, but if I will not ask her to sign it or anything, correct?
Not only the next of kin. You know, in UK,
Mm-hmm.
the patient only who the one assigned to sign his consent.
But if the patient is not competent,
Yeah, so it will be medical decision, and the relative will be sitting just to inform and to be alert about the procedure. Okay, it's
okay,
not
so the
like
medical team.
us. Yeah,
Mm-hmm.
it's not like our culture here. So anyone can sign the first degree, the second degree. No, the patient This is what we realize with the UK people. The person or the patient himself only can sign. Why I'm sitting with this? Son or the daughter or the husband or the wife, just to inform and to be alert and aware about what will happen. Okay, and be sure that the consent will be signed by your husband. If he's unable to sign, it will be signed by the medical team, and the procedure will done at the best interest of it. If she refuse, you can sit with her again and convince her. Call the patient relation, social worker to sit and to know why she's refusing. Okay,
Okay. Okay.
but it's the
Thank you.
matter of the patient only.
Okay. Thank you, Dr. Bal.
Okay, thank you. Don't forget to raise the consent for any procedure. Clear for all?
Okay. Yeah.
Yeah, thank you, Dr. Muhammad.
Done.
Thank you. Any question else before ending the session? Anyone want to comment? Okay, thank you, Dr. Ayula, Dr. Henry again. Thank you everyone
Thank
for
you.
the attendance. See you tomorrow, inshallah, with the long clinical consultation day. Good luck and good night. Assalamu alaikum.
Thank you.